I would go to doctors and their main complaint was, you need to lose weight, you need to lose weight.
I would go to the doctor and ask them, what was wrong, if there was possibly something wrong with my legs, and they just told me that it was obesity.
I would even ask my friends that were overweight, does your fat hurt? And they would look at me like I was crazy. And they'd say, well, no, of course not. And I knew there was something wrong. Why is my fat hurting?
You're told over and over and over again, you're not in pain and your overweight is your fault, so you just believe it.
It's hard to explain if you've never dealt with, a lifelong deformity that nobody knows is a deformity, they just think is fat. So there's so much judgment to go along with it, and it's very, very painful.
I saw Dr. Amron on TV. He was doing an interview with one of his patients, and as they began to talk, I knew that that's what I had, and that's when I called his office.
Lipedema is a condition that's very, very under-recognized around the world, and especially in the United States.
It's altered my gait and the way that I walk, so that it causes a lot of pain in my joints, my knees, hips, and ankles.
I noticed that I was having a harder time walking. My legs were getting bigger. The swelling was getting worse.
They have a lot of pain. They have a lot of numbness. They have decreased ability to move around, to exercise.
When I'm healthy, I can run up and down the sand dunes and I can play with my kids, and I can't play like that anymore. And that's really kind of what this was about, is a last-ditch effort to try to get my joints back so that I can run and so I can walk.
It was an exciting experience because I knew now, regardless of what I'm going to go through, we're going to have a change. We're going to have decreased pain. I'm going to be able to move again. Maybe perhaps I can wear shorts or capris.
He did such an amazing job. He went through and took all of the lipedema part out, all the fat part out that's the painful fat. Then he went back in and felt for all the lipomas.
Every pain that I felt, I knew that it was going to get better, and I just imagined the dresses that I wanted to wear.
Truly change the disease process, and that's where liposuction comes in terms of removing that so-called diseased fat. And then things begin to change. They're able to start exercising, something they really couldn't do well before. They're much more mobile. Their pain has decreased.
I had a really great result. He did a really great job. Since I've regained my mobility, I'm able to work out more, and also my pain has drastically decreased.
By the time they told me, hey, you have nice ankles, I went from, to what?
They've suffered with this condition for years and years and years. So it really it's a very emotional thing for the patient, changing the course of their disease.
After the surgery was done, the second one, I remember sitting up, and this always makes me tearful because it's huge. But I sat up, and I could see my kneecaps for the first time in 15 years. Sorry. For some people, they don't understand that, but anyway, the nurses said, okay, it's time to swing around. I go, can I have a moment? I haven't seen my knees in a while. And so they went, oh, okay. And so I just was amazed at his work. Dr. Amron is amazing. He's done really great work.
So I absolutely feel the need to take on these patients and to earn their trust and to treat them and to really make a change in their lives.
So really grateful to him just for the care and the precision and the expertise that he employs when he does this procedure.
Dr. Amron is very professional, but you can tell he's very sincere and very kind. Like, he really wants to help people. You can see this.
He's such a heartwarming guy that's just so real. Just real and really cared.
Peerless. I would recommend him to anyone. He has the most excellent bedside manner and grasp of what this means to people.
And he hugged me and knows what it's about, and felt very, very comfortable with Dr. Amron from the beginning.
They want to know as much as they can about their condition to make the right choices, and I really commend them. They share information in different Facebook groups about the disease itself in terms of guiding each other.
Don't give up. Don't give up trying to maintain your weight.
Don't let people tell you, oh, you need to lose weight. If you're questioning why you can't lose weight, then there's an issue.
So if it's not about how much you eat, if you're eating normal amounts, like everybody else, then don't stop until you get a diagnosis.
And for women that know that and they know that they've done everything that they can do, don't stop.
And we're out here to support each other. These websites, we talk to each other, we give each other information, and that's what we're here for, to help each other out.